Hello everyone, I'm going to introduce a recent book that we've published in iMeta whose title is Immunomagnetic-bead enriched Culturomics for isolating pathobionts from feces of colorectal cancer patients. The current research status of gut microbes is the research of gut microbes has shifted from descriptive studies in the past to studies on the mechanisms of bacteria-host interactions. The potential pathobionts identified through sequencing correlation analysis, the target bacteria obtained from culture collection centers for field investigation. Ideally, potential pathobionts should be isolated directly from study participants, but current culturomics methods are inefficient for obtaining specific pathobionts. Thus, there is an urgent need to develop a new technology. A lot of studies have shown that common mechanism of action of gut microbiota, induction of chronic inflammation and inflammation leading to gut microbial disorders. Certain bacteria disrupt intestinal integrity by secreting virulent factors and bad metabolites leading to increased intestinal permeability, allowing the bacteria oleometabolites to ectopic and stimulate the body to produce antibodies. Consequently, in this study, we aimed to determine pathobionts-induced antibodies in patients could be used to label magnetic beads for developing immunomagnetic bead-enriched culturomics technique for the efficient isolation of target bacteria, comparison of the pro-inflammatory effect of bacteria isolated in the antibody and blank groups to evaluate the IMBEC technique. This is the flowchart of IMBEC. We isolated a total of 209 bacteria species from 10 samples, and the most prevalent bacteriophyta were Firmicutes, Bacteroidota, Actinomycetota, and Pseudomonadota, accounting for most of the isolated bacteria. 173 from the antibody group, 160 from the blank group, and 124 from both groups. We identified the number of bacteria isolated from each sample and found that while more bacteria species were isolated from the antibody group than from the blank group, the difference was not significant. In addition, we counted the bacteria associated with inflammation or cancer isolated from each sample as follows. Significantly more cancer inflammation-related bacteria were isolated from the antibody group than from the blank group. Criteria for selecting strains. Species reported previously to be related to cancer or inflammation. The experimental strains accounted for more than 80% of the strains only isolated in the antibody group or the blank group. 24 species, including a total of 106 strains, were selected. Co-incubation between THP1 cells and the selected strain to evaluate their pro-inflammatory ability by determining IL-1 beta, TNF-alpha, and IL-6 production in the supernatant. First, the pro-inflammatory effects of isolated bacteria were compared only between the antibody group and the blank group, and we found that significantly higher levels of TNF-alpha and IL-1 beta in the antibody group than in the blank group. However, no significant difference in IL-6 level was observed between the two groups. After that, we compared the bacteria isolated from both groups and found that the strains isolated from the antibody group produced higher levels of IL-1 beta and TNF-alpha in THP1 cells than strains isolated from the blank group. However, this was not the case with IL-6. IMBEC's innovation, using the patient's own production of antibody-labeled magnetic beads to reverse the capture of potentially pathobionts in the organism. The number of species isolated and bacteria associated with cancer inflammation was significantly higher in the antibody group than in the blank group. Bacteria isolated in the antibody group were more pro-inflammatory, indicating that IMBEC improved the efficiency of isolation of pro-inflammatory bacteria.